Hello and welcome to the Center for Global Health Policy at the University of Sussex. My name is Professor Stefan Elba and I am the Director of the Research Center. And in this video I would like to give you a brief overview of a new research project that we have recently started, and that is funded by the European Research Council. The project is called Pharmaceuticals and Security: The Role of Public-Private Collaborations in Strengthening Global Health Security. And the starting point for the project is very much the question of how we can better protect populations against a range of acute cross-border health threats. Over the past several years, there's been growing concern, for example, about how to protect populations against a range of infectious diseases with pandemic potential, ranging from HIV/AIDS through to SARS, through to bird flu or H5N1, and more recently, swine flu or H1N1. In addition to these pandemic threats of naturally occurring infectious diseases, governments have also become more concerned about the threat of a deliberate release of a lethal infectious disease. We saw, for example, in 2001, the mailing of letters laced with anthrax in the United States in 2001, highlighting the continuing threat posed by bioterrorism to several countries. On top of that, there's the continuing burden of infectious diseases in low-income countries, diseases such as HIV/AIDS, tuberculosis, malaria, and a range of other neglected tropical diseases. And so broadly, we've seen a new policy area of health security evolve that is concerned with better and improving the protection of populations against these threats. So looking kind of internationally over the past couple of years, we can see that health security has now become a priority for the coming years for the World Health Organization. We also see in Europe that the European Commission has introduced new proposals in order to prepare the European Union to deal better with a range of cross-border health threats, leading to the creation of new institutions such as the European Centre for Disease Prevention and Control, or ECDC for short, and also the creation of a new Health Security Committee. And then there are also wider forms of international collaboration, such as the Global Health Security Initiative. Now, what we want to do in our research project is focus for the first time on the role of public-private collaborations, and specifically pharmaceutical companies in strengthening health security. So if you think about it, amongst the most important actors when it comes to strengthening health security are not just governments and the international organizations that I just mentioned, but of course also pharmaceutical companies. It's the pharmaceutical companies that will develop the new medicines that we need in order to protect populations, whether those are vaccines, antivirals, or new forms of therapies. Pharmaceutical company is also needed in order to ensure that these medicines are available in sufficient quantities, and that in a moment of crisis, logistically, we can also get these medicines to the right people, to the right places, in the right time. So in that sense, really pharmaceutical companies are not just an important actor in strengthening health security, they are one of the central actors. And yet when we look at what do we actually know about the role of pharmaceutical companies in strengthening health security, we have very little research on this. There is now a growing literature on health security, which looks at what particular diseases also pose wider threats to security. This literature also focuses on the kind of securitization of infectious diseases, but it hasn't really been looked at in detail what pharmaceutical companies are doing in this area. Within international relations, we do have a literature on pharmaceutical companies looking at the kind of international activities of pharmaceutical companies, the ways in which they are also able to shape and influence the global governance of diseases, especially in the areas of intellectual property right and international trade. But this literature has not so far looked at the new activities that pharmaceutical companies are also undertaking specifically in the area of health security. And then we also have a much wider literature, primarily in the disciplines of sociology and anthropology, which is looking more generally at the growing role that pharmaceuticals play in all of our lives at growing rates of international consumption of pharmaceutical products. And although these have focused on a range of different diseases, again, these literatures have not looked at this newer area or domain of health security. So we really want to undertake the first in-depth study of the role of the pharmaceutical industry in strengthening health security. Our study has three kind of primary research questions that we want to investigate. So first of all, we want to look at this from the point of view of governments who are tasked with protecting populations against these health-based threats. We want to see how are governments trying to incentivize or persuade pharmaceutical companies in order to be more active in terms of developing new medicines for health security. So one of the issues here is that many pharmaceutical companies do not naturally see the development of new medical countermeasures as a particularly lucrative or commercially rewarding area to be in. So governments have had to do a range of changes, introduce policy reforms in order to persuade companies to become more active in this area, and we want to begin to analyze these recent changes, whether these are legal changes, changes into the kind of regulatory environment, whether these are new institutions that are set up, and so forth. The second question we want to look at is that we want to then turn this around and also investigate this from the point of view of pharmaceutical companies. We want to understand how health security considerations factor into the business and also non-market strategies of pharmaceutical companies, i.e. why do some companies decide not to engage in the health security agenda, and those that do engage, why do they choose to engage, and how does that fit with their wider business models? The third and last question we then also want to analyze is looking at how this relationship or these forms of collaboration are structured in detail. So there's been a lot of concern in recent years about the influence that pharmaceutical companies may have exerted over particular areas of health security policy. Of course, this is for all actors, this is a very difficult area because on the one hand, clearly there needs to be partnership and there needs to be collaboration. At the same time, of course, pharmaceutical companies are motivated both by their willingness to be partners, but also by their commercial drivers. And so the question is, how do you balance this relationship between pharmaceutical companies as partners for strengthening health security and also as occasionally quite strong lobbyists in terms of their commercial interests? And so these are the three key research questions that we want to explore. The research design we've chosen for this study is that we want to try to explore this relationship in relation to different aspects of the health security agenda and also in relation to different regions. So what we've decided on is that we're going to have three separate research strands. The first one, which will be led by myself, will focus on pandemic preparedness in Europe. So here we're going to look at the kind of arrangements and the kind of collaborations that have emerged in recent years around better protecting populations in Europe against the threat of pandemics, looking in particular at things like antivirals and vaccinations. The second research strand is led by Christopher Long, and this will focus on the United States and looking at what the federal government in the United States has done in order to improve the protection of its population against the threat of bioterrorism. So this research strand will be focusing a lot on things like Project BioShield, also the creation of a new agency, the Biomedical Advanced Research and Development Agency, which will look specifically at developing new medical countermeasures for the strategic national stockpile in the United States. Our third research strand will be led by Dr. Anne Roemer-Mahler, and this will focus on emerging and re-emerging infectious diseases in low-income countries, look at a range of recent collaborations that have been formed in order to develop new medicines for diseases that are prevalent in low-income countries. Overall, what we hope to achieve then by looking at these three research strands is that we want to get a much better understanding of the role of the pharmaceutical industry in strengthening health security. We very much hope that this will also help us to better understand how we can protect populations against a range of cross-border health threats, that we can also learn and identify some of the key challenges that have emerged, prevented more medicines from being developed, that we can also perhaps identify some new insights, some new ideas, or some new business models in order to better strengthen health security in the years ahead. If you do have a couple more moments, I hope you've not only enjoyed this video, but that you might also take some time to look at our web pages. We have additional videos and podcasts specifically about this project, including more detailed presentations on each of our 3 research strands. And of course, you're also more than welcome to browse other areas of the website of the Center for Global Health Policy, where you can also learn more about some of the other research projects that we're undertaking and a lot of the other global health related activities that we're putting on. Thank you very much for the time you took to watch this video. And if you have any questions, please don't hesitate to get in touch. All the contact details can be found on our website. Goodbye.